Well, I know we can say Mahubadai, but this is my first graduation in a long time. So President Dan Shamovitz, Rector Professor Chaim Hames, Dean of the Faculty Professor Angel Porgador, Vice Dean Professor Ilan Shelef, Director of MSIH Professor Alan Jotkowitz, Associate Director Professor Lynn Quittel, family and friends, and of course graduates of Ben Gurion University MSIH class of 2022. It's truly an honor to speak here today, and I thank you, Alan, for inviting me. I know what you're all thinking. What can an oculoplastic surgeon teach me about global medicine? A bit of background, which you heard, I did my residency in ophthalmology at Bellevue Hospital in New York and a fellowship in oculoplastics at Harvard. I made Aliyah in 2004 from St. Louis with my family, and I work currently in the Department of Ophthalmology at Asaf Rofeh, Shamir Medical Center, and I also have a private practice in Ramat HaChayal. In the spring of 2014, my family was planning our summer vacation. My son, Zach, 12 at the time, asked if instead of going on a typical vacation, we could do a volunteer trip. Our other kids, ages 11, 15, and 16, quickly jumped on the idea. After much searching, we found that we could volunteer in the Jewish community in Gondar, Ethiopia. Having no idea what to expect, our family of 6 boarded a flight to Ethiopia in the summer of 2014 after the Gaza war with suitcases full of toys and crafts and games. I'd never been to the third world before, and I didn't tell anyone there I was a doctor. We taught the Ethiopian kids Hebrew songs, dances, told stories, and blew bubbles. The level of poverty was shocking to us. People living in one-room mud huts without running water or toilets. Our Ethiopian Israeli guide, who knew me, asked if I could take a look at an 8-year-old boy with an eye problem, which I did. We went back to our hotel for lunch, and when we returned for the afternoon prayer service, we saw hundreds of people sitting quietly on benches. I said, wow, that's a lot of people for an afternoon prayer service. But our guide said, they're not here for the service, they're here for you to check their eyes. And this was before smartphones, fax, anything. I still don't know how that happened. Equipped with only a pen light, I examined hundreds of people late into the night. I found rampant disease and many people who had never seen a doctor before me. Unfortunately, I had no treatment to offer anyone. We returned to Israel, put pictures on Facebook, and we had no plans to go back. But you can't be exposed to that level of need and poverty and lack of access to medical care and not see the world differently. So 1 year later, our whole family returned, and we set up a mobile eye clinic with eye drops and glasses that we purchased ourselves. At the time, Kofix, if you remember that, sold 5 shekel reading glasses. Every few days, my son would go and clean out their inventory. I made contact with a local hospital in Gondar, and they invited me to operate with them. On that trip, we examined over 300 people in the Jewish community, and pretty soon other villages near Gondar heard about us and asked that we come there too to provide eye care, which we have. Since our first trip, we've been back 12 more times. We've examined personally over 7,000 people, performed over 300 surgeries, given out hundreds of glasses and medications. We no longer have to buy our own glasses. We partner with Restoring Vision in the United States, which supplies me with as many glasses as I need for free. Though last summer, I had to explain to customs at the airport here why I had 600 pairs of glasses in my suitcase. We brought 15 Ethiopian eye doctors to Israel for advanced training. 3 of the 6 oculoplastic surgeons in Ethiopia, with a population of 110 million, have been trained by me. We've taught over 150 youths and physicians basic CPR and first aid, and we've been able to fly 2 critically ill kids to Israel for urgent heart surgery. None of this would have happened if I had not listened to my son. So if you're willing to take that first step outside your comfort zone, you never know where it will lead. I'd like to share a few stories. On that first trip, when I found someone with a cataract, I told them they should go to the hospital, which I didn't even know where it was at the time. No one listened to me, and no one went. On my second trip, I reached out to the doctors at the local hospital and asked them, what should I do if I find a cataract? They said anyone can come to the hospital, register for 15 Ethiopian birr, which at the time was about 2 shekels, and have cataract surgery. I passed this on to the people I examined. Nobody went. I thought they were being non-compliant or negligent, but actually they simply couldn't afford it. On my third trip, the 15-year-old boy who served as my translator angrily yelled at me, "Dr. Morris, why do you keep examining people? None of them are ever going to have surgery." So I negotiated a deal with a private ophthalmologist to do our cataract surgery. I took cash from my own pocket. I gave it to the community leader so he could escort the patients to the private doctor for surgery. Nobody went. I had arranged for a free cure for blindness for these people and nothing. In my head, I thought, what was wrong with them? But I didn't understand that they simply lacked the confidence to go. On my fourth trip, I chose 7 people with the worst, densest, widest, blinding cataracts. I hired a driver. I put them all in the car with me, and I took them straight to the doctor's office. He started operating on them that day. From that moment on, any patient I told to have surgery went straight to the doctor, and now over 300 people have had sight-restoring cataract surgery. They saw that I was there with them all the way, and they learned that they could trust me and rely on me. So if you want to try and truly help someone, you need to step outside your own opinions and your own preconceived notions. You need to listen to what they need and build trust. You have to first understand the culture. This past March, I spoke at a Knesset meeting about humanitarian aid to Ethiopia. I had just returned from Ethiopia, where we had treated 1,000 people in 3 days. After the meeting, the head of one of the major Kupat Cholims, he approached me and he said, "What organization, like Doctors Without Borders?" And I said, "No, it's just me and my family." So he said, "When you go, do they set up like an exam center with all the equipment?" And I said, "No, we go out into the field. We once saw patients in a grain storage bin." And then he said, "How many doctors were on your team?" And I said, "Just me." And he said, "You saw 1,000 patients by yourself?" But I wasn't by myself. My team was my wife, who's here, my 19-year-old son, and 2 of his high school friends. I taught them how to screen for vision, how to do very basic refraction, what medications go with each eye disease. The 5 of us saw nearly 1,000 people, handed out 400 pairs of glasses, and gave out eye drops, and we identified 100 people who needed cataract surgery. The basic needs there are overwhelming. You don't need a fancy setup. You don't need a clinic. You need to be dedicated and flexible, ready to go out into the field and work nonstop. With that mindset, you can do wonderful and amazing things. The leading cause of blindness in Ethiopia is dense cataracts. People who have cataracts are blind, unable to work, and are a burden to their family. I got the idea to run a cataract campaign where we traveled to a remote village, set up an OR, and perform hundreds of cataract surgeries in a week. Sonia Dinner, the energetic and inspirational director of the Deer Foundation, believed in me, and when I told her my idea, she had agreed to provide funding. With her funding, I purchased all the lens implants and consumables we need for each surgery. It didn't take long for things to completely fall apart, starting from the first day of my campaign. Not enough patients with cataracts showed up. The local staff demanded outrageous per diems. Someone tried to steal all of our supplies, and I became the target of a social protest. My guide said that we should leave and drive to his mother's village 45 minutes away. We locked up all our supplies, and we drove over bumpy roads until we reached his mother in Kol Aldiba, which makes Gondar look like downtown Tel Aviv. There we found a hospital where they had never had any eye care. They were thrilled to have us run a cataract campaign. I reached out to my good friends at the Himalayan Cataract Project, a group that has experience doing cataract campaigns in Ethiopia. I made an offer: "I'll give you all my consumables if you help me with the campaign." We returned to Kol Aldiba 6 months later after the rain ended, and this time everything flowed smoothly. We did 225 sight-restoring surgeries in 4 days. To make things happen, you have to first be there on the ground. You have to be persistent, be able to pivot, ask for help when you need it, and stay optimistic. This year, the foundation doubled their funding, and this Saturday night, I'm leaving for the village of Maxinet near Gondar with my daughter, and we plan to do 500 surgeries to make 500 blind people see again. 2 months ago in Ethiopia, in the middle of examining hundreds of people in a dark, cramped tin shack in the village of Azezo, an older man shuffled in on his butt, using his arms to propel him like a sled. His twisted, deformed legs were useless, likely from TB of the spine. The only way to examine him was for me to sit on the floor directly across from him. When I put a pair of glasses on him, and suddenly he could see, his face lit up. I don't know what came over me, but before he shuffled off, I impulsively gave him a hug. More important than providing care, the most critical thing we can do as physicians for the poor is to be there with them. The great Dr. Paul Farmer, who recently passed away, said that the most basic of all human rights is the right to survive, to live. As physicians, you have the distinct opportunity to be there on the ground and directly help people achieve this most basic right. One more story. I met Maisa from Gaza 10 years ago when they brought her to my hospital at Asaf Rofeh. She was then an 8-year-old, very frightened girl with multiple facial injuries suffered in a car accident in which her father had been killed. I operated on her right away and multiple times since, and I have literally watched her grow up. I've gotten to know all of her family, and she's met all of mine. We have a deep bond. Before each visit, her mother Fatima calls me and asks, "So, do you need anything from Gaza?" I say no thanks, but she always brings me shirts, shoes, pants, and much too much baklava. In this increasingly divided world in which we live in nowadays, as physicians, you are in a unique position to cut across all the divides, to build bridges, whether it be in Africa, in Ramla, in Tel Aviv, or in the United States. I never set out to become an eye doctor for the poor in Ethiopia, but I hope my stories demonstrate to you that anyone who is open to it can have an enormous impact on people's lives. All you have to do is take a step. And remember that 15-year-old boy in Gondar who yelled at me? 3 years ago, my family took another step. We adopted him, and now he is studying at Bar-Ilan University with dreams of sitting right now where you are someday and becoming a doctor. So I congratulate you on your graduation, and 32 years after my graduation, I still say this is the best job in the world. Thank you.